I've seen some studies that have said that, particularly in urban areas, that there's a 40% increase in the African American community as it relates to opioids. So it is definitely is affecting all aspects of our society. If you think about the crack epidemic during that time, those were mostly poor Black people that were suffering from this particular addiction. When this opioid crisis began, it began in rural America. And we're talking rural America with mostly white patients. Back whether it was the 80s or now, it's an addiction. And it's a mental health problem that needs to be addressed. And that's how we're addressing it now. We understand that people need therapy, they need counseling, they need access to good health care. And it's as if a light bulb went off now that we realize that. But if you look at it at the surface level, it definitely appears to be consistent with all of the other health disparities that we see within our culture. Now as providers, we realize that, we don't need to be prescribing large quantities of narcotics to patients for several different procedures. I mean, we need to limit the amount that we give at each encounter so that we can help prevent people becoming addicted to certain medications. And now there's several precautions that are placed upon us so that we understand that and that we're more careful with our prescribing habits. And yes, if we have a family member that we see that maybe they're taking too many painkillers, those are things that we need to address quickly and get them the help that they need. It absolutely is affecting our young people. Actually, what we're seeing, kids unfortunately are finding their grandma's pain pills or their parents' pain pills, and they're actually selling them to their friends at schools. And these are not just poor kids. This is your affluent school districts, your affluent private schools. They're selling pain pills. So that's why we often teach patients to, if you have to take narcotics for some type of pain condition, you need to lock them up so that children don't have access to them. So we need to first make sure we're using the right painkiller for the right situation. So not every episode of pain deserves a narcotic. And so that's sometimes difficult for patients to understand that, if you come into the office that you are out painting your house and you have back pain, you don't need Percocet for that particular back pain. So we need to do a better job as health providers. It's teaching patients, the different types of pain and the different types of ways that we can treat pain outside of always thinking that you need a narcotic. Narcotics are good for certain situations. So if you just had your leg amputated, that's severe pain. And so for a few days, you may need a strong narcotic type medication for that particular situation. But that doesn't mean you need to be on that for 4 months. So again, we just need to have smart prescribing for the appropriate situation. And we need to do a better job of educating the community on how we treat pain.